considering the importance of healthcare, share your position on CalCare, and please detail your plans for expanding access to medical services in Sacramento for underserved communities.
Yeah, thank you. CalCare, for those of you who don't know, is universal health care or single payer. The city of Sacramento and the mayor can't implement that. It has nothing to do with the implementation. But you know who does? The state legislature. And I've been a co-author of the bill 3 times. I've been on the hit list of the people who don't like that every time. Because I think health care is a human right. It's the #1 reason people file for bankruptcy. It's a bigger issue about people are actually homeless. It has a major impact on society. And we've seen that the costs of healthcare impact school districts. It was the driver why there was a teacher strike, healthcare. It's the biggest issue on some of these labor beefs as well, healthcare. It's the issue why small businesses are continuing to pay premiums up and up through the roof, healthcare. So I think it's a moral imperative that we take out the waste in the healthcare system. HMOs, the pharmaceutical industry, other entities that are taking it out from direct care to people in the community healthcare. So in my last year of the legislature, I will once again co-author the bill to have single-payer universal health care in California. But as mayor, we have nothing to do with implementing that. We don't run healthcare. What we can be is a voice. And I would make sure that Sacramento leans in and supports that policy. But what we can do is making sure that we do have healthcare programs today. Obamacare, the exchange, isn't perfect. We have like 90% participation in healthcare today because of Obamacare, thanks to President Obama. What the city can do a better job, which we launched this week with Covered California, is going to our youth programs, our community fairs, every aspect of city government to make sure that people know about opportunities to get subsidized healthcare. Because we can't let the perfect be the enemy of the good, and all kinds of issues of government. But one thing specifically that we can lean in is help connect the people of Sacramento to healthcare options. But as far as CalCare, universal healthcare, in my final year of the legislature, I will once again lean in and be a co-author of that bill.
So this is an issue where I've actually been supportive of a lot of Assemblymember McCarty's work, and so I am a long-term supporter of CalCare. I've worked with the nurses on this bill repeatedly, and it emphasized the importance of it for many of the reasons that Assemblymember McCarty already named. That a lot of people living on the streets are there because a health care cost caused them not to be able to work and then caused them to lose their health insurance, or the costs that they were incurring were just so prohibitive that it put them in bankruptcy. I think it is the #1 issue that our small businesses are facing, is the lack of CalCare is hampering the growth of our small businesses. And so I think that needs to be said more, because often this is, couched as an issue that does not affect all of us, but it really would be a boon to our entire economy. And it would really be a way to be able to extend the number of years in our life and the amount of life in our years. As mayor, I think that we need to be much more proactive in emphasizing to our state leaders the importance of having single-payer health care. Because I've seen this bill die without a vote, because we are a single-party state, unfortunately, and people don't want to be on the record voting against it. And so we actually need to be championing this from the perspective of our cities and saying, this is our top priority because of the way that it impacts the people who live in cities. And that's the leadership that I will bring as mayor. I also want to make sure that we are working best with our healthcare plans and also with our county, once again, because they are responsible for so much of the health and human services in the city of Sacramento. And so there are ways. We now will have undocumented people who are going to be eligible for health care next year. And so we need to be doing outreach in all of the languages that are spoken in Sacramento to make sure that people are able to access their care. And that is a responsibility of the city. And so part of what I want us to really be able to beef up here is our community engagement. People in our community should know what's happening. They should be able to easily access it. It should not be hidden behind some veil and then only posted in an agenda 5 days beforehand. We should be able to be active participants in our community. And this is an example where if the entire city of Sacramento, that's our state legislature, if we all came together and said our top issue, we're not leaving until you pass CalCare, we could get some real momentum here. And so so I think we need some leadership to light our fire and say, this is a top priority. We just lived through a global pandemic, and we haven't figured out that it's a bad idea to tie our health insurance to our jobs. Like, we can do better.
In the late 90s, when there wasn't sufficient access to care in our community, Mayor Serna created Sacramento Covered, which was one of the first programs where the city, and then ultimately spun off as a nonprofit, which is now Community Health Works, acknowledged the healthcare disparities in our community. We do have a role to play here. I worked in healthcare for quite a long time. I served on the board of an FQHC, a federally qualified health center, now called One Community Health, for 6 years. The state government, the federal government, they fund healthcare organizations in our community. They fund the county to do this work. And there are some transformational programs going on right now. I do think ultimately a single payer system is the right system. The city is not going to make that manifest if all the other powers that be haven't been able to do that. We have to work with what we have, and what we have is a fragmented system where people don't have adequate transit to get to the healthcare facilities in their district. So we have to make sure that there's more transportation options, that there are more clinics in more neighborhoods. And I'm very proud to have the support of WellSpace, which is our largest community clinic provider in the region. Their medical director, Janine Barra, is a supporter of mine, and we've been talking about how we fill those gaps. Because as much as I would like to wave my magic wand and fix all this stuff, the city's got a lot of different things going on, and we have to work with the healthcare systems that we have. You know, the Morse Avenue Hospital was supposed to be replaced 10 years ago. We still need that new Kaiser Hospital in the rail yards. We still need more access to primary care, which is really hard to get into right now. Medicaid, which in California is called Medi-Cal, is going through a transformation through a program called CalAIM. CalAIM can now pay for housing and other things that help you beyond just direct medical care to get better, to be stable, to get off the streets, and to keep your kids healthy. Both of my kids, we foster adopted. I think about those kids that aren't as lucky to have a home or families that can provide for them. And when we look at whether it's a question about youth, whether it's a question about systemic racism, there is no doubt that healthcare disparities for communities of color in our city are huge. And by doing some of these things, we can make it better.